My research title is The Effect of Prealbumin on Liver in Rheumatoid Arthritis in Iraqi Patients. Abstract: rheumatoid arthritis is a long-term autoimmune disorder that represents by many symptoms like a swollen, painful joint, as well as other organs may be affected like liver. This study suggested that C-reactive protein could be a good inflammatory markers that were reported to have a fatal value for the evaluation of systemic inflammatory disease, and the serum prealbumin concentration might be a more sensitive indicator in assessing liver abnormalities in rheumatoid arthritis patients. The aim of the study was to find the effect of prealbumin protein on liver sufficiency in rheumatoid arthritis patients. Introduction: the C-reactive protein is one of the most responsive acute phase serum reactants produced by liver. Since the C-reactive protein produces various pro-inflammatory cytokines derived either from monocytes and or macrophages, this protein is synthesized by hepatocytes in response to pro-inflammatory cytokines. The prealbumin is a protein synthesized by the liver, the level of which is related to protein metabolism can reflect the body's nutrition and liver function associated with the inflammatory response in the body and widely used in clinical field. The C-reactive protein and serum prealbumin consider the two strong version inflammatory markers for progressions the disease activity in rheumatoid arthritis patients. Material and method. A total of 80 samples rheumatoid arthritis patients with gender 40 female, 40 males with age from 30 to 60 years were collected. The blood was drawn from the participant and was subjected to complete blood count analysis using automated hematology analyzer. The C-reactive protein were prepared using ELISA kit from cell biopsies. The prealbumin was investigated by using ELISA kit from biosource. The data collected was analyzed using Excel 2020. The statistical data was analyzed by student t-test to compare the significance between rheumatoid arthritis and non-rheumatoid arthritis, which are control groups. The result and discussion. As we can see in this table, there is a significant increase in the parameter represented by hemoglobin, white blood cell, neutrophil, lymphocyte, platelet. When we can see compare it between rheumatoid arthritis and control, it shows the level increase in these parameters. Also, we can see the C-reactive protein increase when compare it in rheumatoid arthritis. The levels increase represent two controls, while the prealbumin level is decreased when compare it with the control group. Since the patient with rheumatoid arthritis are more susceptible to unassociated autoimmune liver disease, a wide variety of rheumatic disease affect the liver and it extends significance rule and could cause a hepatic pathology virus. The lack of several nutritional agents have been shown to occur in rheumatoid arthritis, since the prealbumin is regarded as a good marker of current nutritional status because it has a short half-life of 2 days and is not affected by hydration. That we could infer that the poor nutritional status could cause the post-operative liver insufficiency. Furthermore, almost all the serum prealbumin is synthesized in the liver, so its level could be influenced by liver condition, as it has been reported that the prealbumin level could be lowered in patients with acute or chronic liver disease. Prealbumin serum level decreased than 170 was an indicator of malnutrition. Also, the present study showed that the level of C-reactive protein were significantly higher in patients compared to control with significant differences. This higher value of C-reactive protein considered as a signal of active inflammations in rheumatoid arthritis. conclusion, it is important for the rheumatoid patient to be aware and knows the dysfunction of the liver not only as a result of pharmacotherapy but also as a progress disorders associated. In addition, the prealbumin determination is widely available and easy to perform, being a good biomarker of disease activity and play a necessary role in pathogenesis of liver damage with rheumatic disease. Thanks for listening.